Hi, my name's Dr. Harold Kim. I'm an allergist in Kitchener, Ontario and London, Ontario. And the following information you're going to see is actually meant for my patients that we take care of in our clinics. But if you're using the information for yourself, it should be used under the management of your physician. So one of the type of inhalers that we use quite commonly in asthma is called the Turbuhaler. The most common drug that we use this with is called Symbicort. And Symbicort is a drug that has an inhaled steroid and a bronchodilator together. And the purpose of this medication is to decrease the inflammation in your airways and also open your airways up. This medication can be used in 3 different ways. One way is if you have really mild intermittent asthma, then you can just use it as needed. If you have persisting asthma, then you should use it regularly, so 1 or 2 inhalations twice per day. And then you can also use it as a maintenance medication where you're using the inhaler once or twice per day regularly, and then you can take extra inhalations on top. So let's just go over how to use this. So it comes in a container with the cap on. You take the cap off. You can see that the device has a bottom that's red and then a top that's white. And essentially what you do is you twist the bottom one way and then twist the bottom back. Then you put the inhaler in your mouth and suck in fast and deep and hold your breath for 10 seconds. And then breathe out. It can be used in children as young as 6 years of age. Usually under 6 years of age, it's difficult to use this type of device, but typically 6 years and up is a good time to use it. And you can use it, as I've mentioned, for very mild asthma all the way up to very severe asthma. I would recommend, if you're using it regularly, to rinse and spit after you use it, especially for your maintenance inhalations. When you take it as a rescue inhalation, you don't have to rinse and spit. You can just use it and then just go on with things. If this medication is not controlling your asthma after taking a few rescue inhalations, then you should see a physician. If the symptoms are severe and you're really symptomatic, then you should go into the emergency department. So that's in a nutshell how to use Symbicort. And again, this is a good medication for mild intermittent asthma and also for relatively moderate to severe asthma.